So welcome everybody to the COVID and Cancer series, which is part of Woman to Woman's ongoing effort to bring timely and relevant information regarding the current pandemic to our gynecologic cancer population. We are so incredibly lucky that Dr. Cardinale Smith has generously volunteered her very precious time. She is super busy these days to speak to us and to answer any questions. For those of you who attended the other sessions that she led, it is an incredible opportunity to hear directly from the source the hot off the press latest information specifically about COVID and how it relates not just to the population at large, but specifically to the gynecologic cancer community. So Dr. Smith, thank you so much for being here with us today. For those of you who don't know Dr. Smith, she is an MD, PhD, Associate Professor of Medicine in Hematology and Medical Oncology, Palliative Medicine, and Director of Quality for Cancer Services at Mount Sinai Hospital. She was one of the top 40 inspirational leaders under 40 by the American Academy of Hospice and Palliative Medicine. She can explain a little bit more about what she's been doing. She's been very busy during the current pandemic, but I will turn the mic over to her right now, and we want to get every second that we can with you. So thank you again so much for being here.
Thank you, and hello everyone. It's great to be here to give an update. All right, so first, happy Valentine's Day. I hope you all get to celebrate in some way. Unfortunately, I don't really own many colors other than black and gray, so I'm not able to be festive today. But just wanted to give you some most recent updates of where we stand. So what's the current status of COVID-19? In the United States, there has been a total of 547 million doses that have been given, which equals 213 million fully vaccinated people, which is, almost 65% of the entire US population. In New York specifically, that translates to about 75% of the total population, eligible population is fully vaccinated, which is great for us here in New York. Most recently, our 7-day rolling average, so that's how many people are positive, of all of those people that are being tested, how many of them are coming back as positive. And in New York City, as of today, it's 2%. Another way people talk about this, or you might have heard it, is the total numbers per 100,000. So this is 15 people per 100,000 are coming back positive. And the reason why that's important is because when we talk about what's sort of high risk transmission in the community, or sort of high levels of transmission in the community, that's when we're at 50 per 100,000. So that's considered a high level. So we're now more into sort of the low level. And then within Westchester, it's 3% and 14 per 100,000. So very similar. We are coming down off of the most recent Omicron surge really pretty quickly across the Mount Sinai health system during the very first COVID wave in March of 2020. When we were at capacity, we had approximately 2,000 patients hospitalized across our health system. When we had the Delta wave, we had approximately 700 hospitalized across our health system. And most recently with Omicron, we were at about 1,000. So, both, half or a little less than half of where we were with the first wave. Omicron hit us a little bit harder than Delta did in just a quicker, smaller amount of time. And we remain at about 55% of all of those patients being hospitalized, being unvaccinated. And for us, those who are vaccinated and hospitalized, this time what was different is that there were a fair amount of people who were hospitalized with COVID and having COVID making one of their underlying illnesses worse. So for example, someone with diabetes coming in with really high sugars and also having COVID symptoms and testing positive, and COVID tipped them over the edge in terms of their diabetes. And the same with heart failure, and we saw the same with cancer as well. And so the vaccines are safe. This is a slide from that I have shown previously as well. We know that when we think about the mitigation risks, what are those layers that we can do to make us the safest? You know, the layers are masking, they are, physically distancing, and getting vaccinated. And so we know that there are 3 vaccines currently approved in the United States. That's the Pfizer, BioNTech, Moderna, and Janssen J&J. So far, the contraindications to folks getting the vaccine is really if you have an allergic reaction to one of these ingredients. There are some other medical contraindications that are really rare, but they do exist. And there have been some updates to vaccines, particularly for those who are considered moderately to severely immunocompromised. And so you are considered moderately to severely immunocompromised if you have current cancer and are undergoing treatment, or if you have most recently completed cancer treatment within the last 6 months. So for those who are no longer in cancer treatment and are, in remission or are in survivorship, have survivorship plans in place, you would not be considered moderately to severely immunocompromised. But if you are on any form of treatment for your cancer, then you would fall into this category. And the way vaccines work for that is for Pfizer, you get dose 1, then you get dose 2 3 weeks after dose 1, and then you get dose 3 28 days after dose 2. And so for the non-immunocompromised people, a primary series is considered the 2 doses plus a booster. But for those who fall into the immunocompromised category, primary series are 3 doses. So 3 doses for moderately to severely immunocompromised equals 2 for those who are not. And then the recommendation is that those folks get a booster, which would be 4 doses, and you get that 5 months after you get dose number 3. For Moderna, the timeline is the same. The difference is that the booster, or the 4th dose, is a half dose of the first 3 doses. And that's the way the Moderna approval happened, is that the booster for Moderna is a half dose of the regular vaccine. And then if you got the J&J, you get dose 1, which is a full dose. And then the recommendation is that you get a booster dose with either Pfizer or Moderna 2 months after you got the first dose. So, these guidelines and recommendations are constantly evolving and changing. And this most recent one actually just got updated a week ago. So if you are someone who may be saying, hey, I got 3 doses, but I didn't get a booster yet, or, I've gotten 3 doses, should I get a 4th dose? You should get a 4th dose if you fall into that moderately to severely immunocompromised category. And then you count 5 days after you got dose number 3, 5 months after you got dose number 3. And the pharmacies, I think most pharmacies are aware of this. Certainly, if you get your vaccine within the Mount Sinai Health System, our vaccine places are fully aware of this and know and won't turn you away for a 4th dose. And so how well does the vaccine work in people with cancer? We certainly have more information now than we had before. And we know that the vaccine doesn't work as well in people with cancer who are actively ongoing treatment. And even within that category, there are differences. So focusing specifically on those people with solid tumor cancers like gynecologic malignancies, for the most part, people should have a response by the time you get to the booster. And again, for those folks, that's 4 total doses. So it's not 2 or it's not 3. And one of the ways in which you can know that, so how do I know if the vaccine worked? One of the ways in which you can do that is with what's called an anti-spike antibody. So this is the antibody level that you have that tells you how many antibodies you've developed, either from natural immunity because you had COVID, or from the vaccine itself, or maybe a combination of the two, having an infection and having been vaccinated. And the levels are low, moderate, and high. If you have anything that is moderate and high, you are considered protected, right? And protected doesn't mean that you won't get the infection, but protected means that you shouldn't have serious complications if you were to be infected. And that means you shouldn't be hospitalized and not die from the virus. And that's really the things that we are working towards the most. I heard a friend, one of my infectious disease friends shared, she says that an anecdote with me that getting the vaccines is sort of like having an umbrella in the rain. So that, you have an umbrella out in the rain, and it doesn't mean you don't get a little wet, right? You get a little wet, but you don't get soaked. And that's kind of what the vaccine is. The vaccine is a layer of protection. So it's not necessarily preventing you from getting the virus itself, but it's preventing you from having those really bad complications. There is a new medication out called Evusheld. It is an injection monoclonal antibody. So what that means is that it's an injection medicine that's targeted specifically to most of the COVID variants. And this medication is an injection. You get it every 6 months while COVID numbers are high in the community. And you are eligible for this injection medication if you do not have antibodies despite receiving the vaccines, or if you have a true medical reason why you cannot get the vaccine. This is a way to try and offer you some protection that the vaccine is not offering to you. And this medication does exist. We're giving it within the Mount Sinai Health System. And again, you qualify if you do not have any antibodies after you've been vaccinated. And so what if I'm on active treatment? I think we really don't know what the best timing is to give the vaccine for someone who's actively receiving treatment for cancer. And what I mean by that is that there are certain treatments so in order for the vaccine to work well, you have to develop antibodies, right? And antibodies are, in technical terms, they're your B cells. So those are your antibody cells. And there are certain treatments that prevent your body from making those B cells appropriately. They tend not to be most of the chemotherapy or treatments that we give for gynecologic cancers or for solid tumors as a whole. It mostly impacts those people with hematologic malignancies like lymphoma, leukemia. It doesn't impact the solid tumor patients as much. But that being said, depending on some of your other underlying medical conditions, your body may not be able to have an antibody response to a vaccine the same way that someone who doesn't have cancer can. And so for that reason, people talk about trying to give the vaccine, at least 2 weeks before you're due for your next dose, so that your body has time to make those antibodies before you get the next treatment that will suppress your body's ability to do so. That being said, we say, please get your vaccine and your booster when you are eligible. We don't have any scientific data to say that waiting until that 2-week mark really makes that much of a difference. And it's more important that you try to be protected. So are there special precautions that people with cancer should take? I think that most of these recommendations stay the same. And truthfully, where we are now going, as I personally am experiencing it in my school system with my children, is that there really is this divide, right? There's a group of people who says, we're not going to be able to live like this forever. Let's go back out into the world like COVID never existed. Let's go back to 2019 world. And then there's a group of folks, maybe there's three groups. There's a group of folks who's like, no, 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 no. Let's keep going the way we have been going, because truth is there is still a segment of our population who's not been afforded a protection from a vaccine, mainly that group of 6 months to 5-year-olds, right? That they're not yet eligible. And so let's keep going the way we've been going. And then there's maybe a group in the middle that's like, okay, we've got to maybe do a little bit of both, right? We have to think about how do you identify evidence-based metrics where we can sort of come off the off-ramp, right? We can take the off-ramp, but then have clear guardrails in place for when we need to get back on the highway. And I think that's what a lot of struggle is currently happening. And, different states are navigating this in different ways. I think that the middle ground here is that you first look at, there are several things you can look at in the community. One is, what is that transmission rate, right? And at the beginning, I showed you that right now our transmission rate in New York City and Westchester is low. So that's good. Then you look at the vaccination rates. Ideally, you would want vaccination rates to be above 80%. We're at 75%, so we're almost there. And then you want to look at hospitalizations and capacity. And our hospitalizations across New York City and Westchester have gone down significantly, and hospitals and medical care are operating at normal capacity. So all of that says this is probably a time where we can start to loosen and relax restrictions, right? We know that the indoor mask mandate has gone away in New York City, and I know people feel very differently about that. I think, this is a time where we can start making those changes, and then each individual has to identify, sort of what their risk threshold is, how risk averse they are or are not. I can share just my own family. I have elderly, parents who live with me who have underlying medical conditions. They're vaccinated, they're boosted. I have 2 young children, 9 and 5. The 5-year-old got her first dose on her birthday, which was January 2nd, and is now fully vaccinated. So everyone in my household who can be vaccinated and boosted are. So we are as protected as we can be. When we go indoors, we're still going to mask because that's what makes us feel more comfortable. But, we will, once the weather gets nicer, we will go and have we will eat at outdoor restaurants with outdoor seating. And when we go outside, when it's just us, we're not wearing our mask. We gather in limited numbers with other family members, like my sister, my niece, my brother-in-law, who are also fully vaccinated. And I think that's where you have to start making these risk decisions for yourselves. There are things that you can do to mitigate risk, like having folks do a rapid antigen test before they come over to see you, or before you gather together with them. The key thing to remember about that is that, the antigen test just tells you that moment in time. And so they're certainly not perfect. And because I overshare, I'll share with you too that over Christmas, right, when Omicron was really high, and I told you my 5-year-old wasn't yet vaccinated, I was really on the fence about whether I was going to have my sister, my niece, and brother-in-law over for Christmas. We celebrate Christmas. And, and the kids just pestered me. They really wanted to see their cousin. They really wanted to see their aunt. And so we all tested. We all antigen tested. We were all negative. And then the next day in the evening, my sister called me because my niece wasn't feeling so good. And they antigen tested her, and her test came back positive. And, the rest of us, we went and got tested 3 to 5 days later, as are the recommendations after you're exposed. And thankfully, every other member of my household and my sister and brother-in-law came back negative, because vaccines do work and we can protect each other. But it's just to say that these are the risks that we all have to decide what we're willing to live with. So I think I talked about this. If you're exposed to someone with COVID-19, what should you do? Well, we consider a high-risk exposure to be someone who is not vaccinated or immunocompromised within 6 feet for greater than 15-minute unmasked as high-risk exposure. You no longer have to quarantine if you've had a high-risk exposure, but if you are vaccinated, but you are recommended to test yourself within 3 to 5 days of exposure. The 5 days was more Delta, because that seemed to be how long it was taking. The 3 days seemed to be more Omicron, because it was just more infectious, and so people were coming back positive faster. And then, of course, encourage you to contact your oncologist or primary care doctor for other recommendations if you test positive. We do have infusion medications, what we call monoclonal antibodies, to treat someone if they are positive with COVID with symptoms and are at high risk for complications. So that would be, again, our patients who are considered immunocompromised, so patients with cancer actively on treatment. And there is one medication, the name is sotrovimab specifically, that has activity against Omicron. The prior medications that we were using during Delta do not have activity against Omicron, so they stopped being used. And so what else can you do? I think we talked about this a little bit. The most important thing you can do is just to follow the current public health guidance, although it may be hard and it may be confusing. We, of course, encourage everyone to be vaccinated, and even more importantly, just as importantly, have your close contacts get vaccinated, so that they are providing a bubble and a layer of added protection around you. Is there anything you can do to improve your general health and immune system? I think listening to the recommendations of your care team for a healthy lifestyle, though I love chocolate cake, you can't eat it every day. So everything in moderation, which includes a well-balanced diet that's rich in fruits and vegetables, exercising regularly, which means trying to get your heart rate up about 30 minutes, at least 3 times a week is what that means, or as close to 3 times a week as you can. Sleeping for, a minimum of 7 hours, and then following all the important hand washing protocols, and avoiding tobacco products. So when will things return to normal? I don't know that things are ever really going to get back to normal, right? I just think there's this new way of being, and everybody is going to approach it very differently. But I outlined already some of the things in this slide, particularly the things to take into account. Whether you're here or you plan on traveling somewhere else, there's lots of wonderful data on Google about transmission numbers in other states and other countries. Right now, the federal guidance is still to mask. So on planes, masks are still required. And I think I covered most of the other things on this slide. And that's really it. That's all the slides that I have. So I will stop sharing so we can be on the screen, and then happy to take any questions if you have them.
There was a question in the chat. And so Jeannie is asking, is there anything one needs to prove or present at a pharmacy to receive a 4th dose?
No, you do not. You should just tell them that you are immunocompromised and therefore are eligible for a 4th dose.
Got it. That's a really good question. A couple of things that I'm wondering, and everyone, please feel free to either put your questions in the chat, or if you want to raise your hand. Actually, why don't we let Robin's hand is up. So Robin, why don't you go first?
It depends, there's the personal part of that. I would say in general, If you needed to be around this person for a prolonged period of time, then masks. And remember, what we know now, particularly for Omicron, is that you want one of the higher level masks. So KN95, N95, if you have it, certainly a surgical mask at a minimum, not a cloth mask. I think if you are going to be indoor, I would try to gather with this person outdoors where there's more ventilation. If you're going to be gathering indoors, you want to be able to do it in a way where, you have ventilation, you have windows open. If you have any sort of an air purifier, a HEPA filtration system, just to get the air circulating around. And then lastly, of course, testing before you get together. Those are really the best things that you can do to lower your risk to be around someone who is unvaccinated. The masks are good, but no mask is perfect, right? And really the best masks that we have are those N95s. And that's what we tend to use. That's what we use in healthcare facilities. And I don't know if anyone's had the opportunity to wear an N95, but it is, there's not air, this isn't the mask where your glasses are going to get fogged up, right? Because it's a very tight seal. And even those of us who may not have breathing problems may feel a little claustrophobic with it, right? You can't really get a lot of air. So those are the masks where you're like 99% protected. Outside of that, the protection goes down. So while it is true that you being the masked person, you are affording yourself more protection than the person who is unmasked, it is not 100%, because the particulates coming out of the unmasked person can still get in through your mask because the mask is not perfect. Again, it lowers your risk significantly, but it doesn't take it down to zero, if that makes sense.
I would just, as a follow-up to Robin's, I'm wondering, Dr. Smith, what you think in terms of face shields, because I know in the hospital, when the numbers were higher, we were told we needed to wear face shields in addition. And I'm wondering if that's something that is useful information at all for our patients.
Yeah, so part of the reason why we added the face shield is because if you think about the routes that the virus can go, the COVID virus can go, it's in through your nasal passages, your mouth, because it's an airborne virus. And, as we talk, there's some, saliva, some spit that comes out from all of us. And that could also go into the mucous membranes of your eyes, which is why we, we cover them in healthcare settings. And the reason why we do that in healthcare settings is because that is a much higher risk area, right? We are much more likely to come in contact with folks who are COVID positive, who may not know it, or be treating patients who do have it. So that was a way to decrease and mitigate risk even more for the population of folks who were at higher risk just from exposure. Now, I don't know that we all in the community need to walk around with some sort of face shield. I do think that there are those times where you may be put in a high risk exposure situation and you may want to consider it. So for example, if you're flying on the plane, right? My family and I are going on our first plane trip next week since November of 2019. And despite the incredible anxiety that I have about all of it, I got us face shields for the plane, and particularly, we're going to have to drink water or, eat some snacks. And so I got it for us for the plane as an added layer of protection. But I don't think that it is something that every day you need to use every day.
That's really helpful. So another question that I'm wondering is, you were talking about patients who are in active cancer treatment. A lot of our patients are actually on maintenance, or they take something like a PARP inhibitor, or they go regularly, every few months, for maintenance infusion. What category would those patients fall into?
Yeah. So each type of drug has a different risk category. I would say in general, most of the cancer treatments with the exception of hormonal treatments, would fall under the category of putting you at moderate to severely immunocompromised. So, those hormonal treatments are like the Arimidex, like those types of medications. But the PARP inhibitors, some of the other oral chemotherapy drugs, most of the infusional agents would put you in the moderately to severely immunocompromised category.
So the next question is, would you personally put your child, who hypothetically was not vaccinated because the child was under 5, together with family members who refused to get vaccinated?
That is such a personal question. I mean, for me and my personal viewpoint, I would not have. And I was in that situation only I wasn't in a situation where I had family members refuse to be vaccinated, but where I had an under 5 child who was not yet eligible, and I would not put her in that situation. It's my personal viewpoint, though. Everybody's situation is different.
So a family get together with family not living in my house with my husband and I, we should not get together. I just restarted chemo treatment for a recurrence and had 3 doses of the vaccine.
Yeah. So I think, this is going to be a personal decision depending on how much you want to be involved with the family. I think the things that you should think about in making that decision are the vaccination status of all people. So, you have 3 doses. Hopefully when you are eligible for dose 4, you will get dose 4 and be boosted. You would want to know if those that you are going to be gathered with outside of your household are vaccinated. Obviously, if they are fully vaccinated. And honestly, soon, the definition of fully vaccinated is going to be 3 doses. It's going to be the primary vaccine plus booster for those who don't need 4 doses, and it'll be 4 doses for those who are eligible for 4 doses. I mean, we're already seeing that in the healthcare setting, right? In New York, February 21st, a week from today, is the mandated requirement for us all to be boosted. So it's coming. So that's one. I think the other thing is, where are those folks coming from, and what are the activities that they engage in, sort of understanding risk. I think if this is family that you want to get together with wearing masks, right? Part of what I think helped with my own family situation at Christmas is that I required, my unvaccinated child to wear a mask, as did, we did when we weren't, eating, we were all masked. So I think that you can consider masking, and of course, testing the day of getting together. And all of those things are things that you can do to reduce your risk. So I wouldn't say, no, don't get together with anyone, but I would say, think about how important it is. And if it's important to see those people, then those are the strategies that you can take to decrease your risk. Good question. So I think the things that you can do to protect yourself are, if you fall into the moderately to severely immunocompromised category, that make sure you get your 4th dose as soon as you're eligible. And I know, not everybody's eligible, but yet, because August was when dose number 3 became approved. So there are some people who are just getting to eligibility for 5 months after dose 3. But make sure that you are boosted as appropriate, whether that's dose 3 or 4. Make sure, that your husband, that the husband is boosted or vaccinated as appropriate. And, the other things that you can do are mask. And if those folks who are not vaccinated are open to some sort of surveillance testing, even with antigen testing, once a week or so, just so that if they were to be positive, you could put things in place pretty quickly to make sure that you are distancing, and that those folks could isolate. By getting vaccinated and boosted are really helping to mitigate your risk as much as you can.
Another question in the chat. So do you feel we need to stay masked with vaccinated people inside while we're in active treatment?
I think to be safest, yes. I think that is the safest. That's the thing that is going to be the most safe for you while you're on active treatment. if you don't want to be masked or those around you have challenges with being masked, then the things that you can do to mitigate your risk more would be making sure the air is circulating around, either through open windows, doors, or the air purifier filtration systems. And you can buy like external ones, and testing prior to gathering.
A couple of questions kind of as follow-ups to both of these. In terms of general immune boosting, sort of related to what Hildred was saying, I know you talked about sort of general health guidelines. Are there any supplements or vitamins, just again, not to prevent COVID, but that you would recommend to patients as sort of general immune boosting, with the knowledge that before anybody adds anything, they should check with their oncologist?
Yeah. So I mean, I think, proactively things that you want to make sure of is, like your vitamin D levels. This is part of, depending on what age you are, vitamin D screening happens with your primary care doctor routinely. But you want to make sure you don't have any vitamin deficiencies, and the most common being vitamin D. Followed by like vitamin B12, so that you want to make sure you are taking supplements for that as appropriate. And then I think other than that, it's just really a multivitamin a day. You want to make sure that you're getting adequate vitamin A and vitamin E, and all of that is in a multivitamin. Outside of that, there are no other specific supplements to boost your immune system that we know of that works better than a multivitamin a day. I would say in general, that is something that you could do, right? And if we look at why, right now we know that our general transmission rates, assuming you're in New York City, are low, right, at 3%. And so the likelihood that other people are positive are very low. And I think in addition to what you said about having people come over masked, the other layer I would add to that is just testing, right? Making folks test before they come over the day of, with an antigen test, and making sure that they are healthy without any symptoms before they come over. And I think that is, to have folks over, this is sort of like the window to do it if you want to do it while the rates are low.
Regarding the masks, there's also a lot of talk about KF94 masks. What is your opinion about those, and what is kind of the party line if those are as effective as N95 or as N95 or KN95?
Yeah, so the KF94s are the masks that are used most commonly in South Korea, and South Korea has their own system of, very similar to what our FDA does in terms of testing masks. And so at least from what we can tell, the KF94s, the KN95s, and the N9, the KFN94s and the KN95s are very similar, and they would be just one step below the N95. I think the thing that's important is you want to try and make sure you're buying it from a reputable distributor, because, you go on Amazon and everybody's making things up nowadays, and you don't know that they're actually certified and have gone through testing, right? So all of these masks go through testing to ensure the size of the virus or the particles that go through are aligned with what that mask is supposed to be preventing. And so, I mean, depending on how into the weeds on this you want to get, the FDA has a website where they have all of their FDA authorized KF94s, KN95s, and N95s. And so you can match, the brand and the serial number with what you see on that website. If you don't want to go that into the weeds, there are companies that I have found where, I order from my own family that do this work for you. And so the N95project.org is where you can get not just N95s, but also those other masks we talked about. And then Protectly, I own no stock in these companies, I promise. They've made a fair amount of money off of me for sure. But Protectly FDA.org is the other company that I have found, and they are both reputable and do the research and only sell those products that are manufactured by the those that are FDA approved.
Also wondering how much protection you think is offered for somebody who has gotten COVID, and kind of the implications of that in terms of, risk.
Yeah, that seems to be the hot topic now. So that I think prior with Delta, what the data set showed us was that quote unquote natural immunity, or the protection you get from having had COVID itself, lasts for about 90 days. And that was where this 90-day limit came up for, for travel, for going into restaurants, et cetera, which is that we believed that you would have antibodies to COVID, natural antibodies to COVID, for about 90 days on average after infection. And so that's your window of protection. What we hadn't seen was that having received natural antibodies from infection with vaccination somehow improved your overall immunity or the level of antibodies. But that seems to be changing with Omicron, which is that what seems to be happening is that those who are vaccinated and being infected with the Omicron variant, those antibodies seem to be even more robust. And now the question is, what does that mean? And does that mean that it will protect you from future infections with Omicron specifically? Will it protect you more from future infections with other variants that may come about? Those are questions that we just don't yet have answers to, but it does seem like the combination is now offering some added protection that we did not see with Delta or Alpha, Beta, any of the other ones that came along before then.
I've heard of people using the expression, they want to just get it over with, and almost kind of like those chicken pox parties, back in the day.
Yes.
And then there's a lot of, I read articles from reputable sources saying, do not do that. Do not go and get it over with. So could you talk about that a little bit?
Yeah, I would definitely say do not. I definitely remember, I am old enough where the chickenpox vaccine did not exist for me. And I remember my mom and grandma putting me in the bathtub with my sister who had it. And they're like, go to town, girls, and it didn't work for me. I didn't get it. And I waited until I was 15 when I got it. So there's always that. But don't do it. And the reason why we say that is because while for those of you who are hopefully vaccinated and boosted, you will be protected from having acute serious complications. So in the short term, what we don't know is what that means for you for the long term. And what we're starting to hear reports about now are actually in children, whereas we hadn't really seen the long hauler effects in children, like we did in adults with Delta. What we're seeing now from Omicron are a lot of children having long-term sequelae, fatigue for months on end, brain fog for months on end, GI distress for months on end. And that's in the children as well as the adults. What we don't know is are we seeing this in the children with Omicron because Omicron itself is somehow different? Or is it just because Omicron burnt through so many children that we didn't see it at this level of Delta? So there just wasn't a way to be able to pick that up. I don't think we know, but the reality is that it's not just the short-term complications with this virus that one has to be concerned about, it's the longer-term complications. And so, I would suggest not just trying to get it over with, but really continuing to do all of these risk mitigation strategies, because you have to worry about the short-term and the long-term.
Dr. Smith, if people are looking for more information, where do you suggest that they go for reliable information? Because I think that, as Barbara said, there's a lot of conflicting information, even among healthcare professionals. So where would you suggest?
Yeah, so I think specifically for cancer patients, cancer.net is a really great resource. It's supported by the American Society of Clinical Oncology. It is written in, non-medical speak, in lay language so that you can understand, and it is updated twice a week. So the most current guidance goes there, and they will link you out to the source information. So if they're getting information from the CDC, it will link you out to the CDC. And then, of course, for specific New York State and New York City guidance, the New York State Department of Health website, but that can be a little challenging to negotiate, which is why I think cancer.net is a really good resource.
Thank you so much. Again, the opportunity to have a full hour of you and your time and your expertise and your opinion, which I think is really great. And I know a lot of people were saying, what would you do? And I think by sharing your family's experience and some of the decisions that you have made, that's really, really helpful. As we keep on saying, a lot of this is very personal. It's personal to everyone's medical situation. It's personal to your belief system, to your risk, comfort level, but it is unbelievably helpful during this stressful time for so many to hear directly from you, just reliable information. So thank you all for participating today. This will be recorded, or is recorded. It will be in our video library. Takes a little while to get uploaded by the time it's edited, but I'm sure it's going to be a source of information to so many. So Dr. Smith, thank you again for taking the time. Thank you to all of you. Stay safe, be well, and happy Valentine's Day.